guys, this is April and this is my YouTube channel. The Prime Minister of Scotland gave the new updates of COVID cases here in Scotland, and to all people who do not know yet about the news, please keep watching and I hope you are very well, and please stay home and safety.
Have been registered all patients who first tested positive over the previous 28 days. That is the highest number of deaths we've reported in the daily figures since the 21st of May, and it takes the total number of deaths under this measurement to 2,653. National Records of Scotland has also just published its weekly update, which you will recall includes cases where COVID is a suspected or contributory cause of death. And today's update shows that by Sunday just past, the total number of registered deaths linked to COVID under that wider definition was 4,376. 75 of those deaths were registered last week. That is 50 more than in the week before, and that is the highest weekly total since early June. 58 of the 75 deaths took place in hospitals, 12 in care homes, and 5 at home or in other non-institutional settings. Every single death, of course, represents the loss of somebody who was special and loved, and I want again today to send my deepest condolences to all of the families and networks of friends across the country who have been impacted in this most extreme and cruel way by the impact of this virus. I want though to just give a point of context though, and it doesn't in any way take away from the very upsetting nature of the statistics I have just reported to you. But today's figures on hospital and ICU admissions and the figures I've just reported on deaths are obviously clearly concerning, and we take them very seriously as we consider our response and our next steps in the fight against the virus. However, as Jason will touch on briefly as well, these figures, it must be remembered, relate to people who could have been infected with the virus perhaps 2 to 3 weeks ago. So they should not be taken as an indication that the current restrictions that we are all living under are not having any impact, and I'll say a little bit more about the early indications of the impact they're having later on. My main update for today though concerns the temporary restrictions on hospitality which we introduced 2 weeks ago and which legally took effect on Friday the 9th of October. As I said yesterday, we will publish, and I can tell you now that we will do this on Friday, a new strategic framework for managing the virus and indeed living with the virus through the winter and into the early part of next year. That strategic framework will include different levels of restrictions that can be applied either nationally or regionally depending on the level of infection across the country or in different parts of the country. Subject to parliamentary approval of the broad framework, it is intended that the levels will be applied from the 2nd of November and reviewed regularly thereafter. The detail of what level will initially apply to each part of the country will be assessed in the coming days and set out in advance of 2nd November. And it's important for me to be clear at this stage that given the nature of what we're dealing with and given some of the numbers I've just reported, albeit with the caveats attached to them that I did, we can't rule out that this new approach will entail further extension of existing restrictions or perhaps even tougher restrictions for all other parts of the country if we think that is necessary to safeguard health and life. But that will depend on up-to-date assessments of the impact of the current restrictions, and it's also important to be very clear that all of our decisions will be balanced by an assessment of the wider harms that COVID and the measures we're taking to tackle it are having, and that includes the wider harms to health and well-being and to jobs and livelihoods. The timescale for introducing the new level system, though, leaves us with a short-term decision about the current temporary restrictions on hospitality. These are currently due to expire on Monday coming, the 26th of October. However, following a meeting of the Cabinet this morning, I can confirm that we have decided to extend these measures for a further week. This is first and foremost a public health decision. Although we have grounds for cautious optimism that the restrictions are having an effect, the clinical advice to Cabinet is that it would not be safe to lift them as early as Monday. Secondly, the extension allows us to transition more smoothly to the new level system that we hope will be introduced on the 2nd of November. So I can confirm that the current temporary restrictions will now apply until 6 a.m. on Monday the 2nd of November, and that of course includes the tighter restrictions that are currently in place across the Central Belt. Let me run through what those restrictions are, but before I do so, let me take the opportunity to remind everyone that the rule against visiting other people's houses also remains in place for now, because that is the best way of limiting transmission from one household to another. But let me run through the wider restrictions. Firstly, and with the exception of the 5 Central Belt Health Board areas that I'll come on to in a moment, the restrictions mean that pubs, bars, restaurants and cafes can only operate indoors from 6 a.m. to 6 p.m. These premises cannot serve alcohol indoors at any time, although they can serve alcohol outdoors up until 10 p.m. In addition, hotel restaurants can serve residents indoors beyond 6 p.m, but not with alcohol. We also introduced much tighter restrictions in the 5 health board regions where case numbers have been especially high. Those are Greater Glasgow and Clyde, Lanarkshire, Ayrshire and Arran, Lothian and Forth Valley. In these areas, all licensed bars and restaurants must remain closed indoors and outdoors, although takeaways are permitted. And again, there's an exception for hotels serving food and non-alcoholic drinks to guests. And cafes, whether licensed or unlicensed, can stay open until 6 p.m. to prevent social isolation, but they must not serve alcohol. In addition, in these areas, snooker and pool halls, indoor bowling alleys, casinos and bingo halls will remain closed for an additional week. Contact sports for people aged 18 and over will also remain suspended, with an exception for professional sports. Indoor group exercise activities will not be allowed for people aged 18 and over for that further week, although gyms and pools can remain open for individual exercise, and outdoor live events are not permitted in those 5 regions. Finally, we continue to advise people very strongly who live in these Central Belt areas not to travel outside the health board area that they live in if they do not need to do so. Similarly, people in other parts of Scotland should not travel to these areas unless it is absolutely necessary. I know all of this is really unwelcome, and I know that these restrictions are harsh. They are harsh financially for many individuals and businesses, and they are harsh emotionally for all of us. And so I want to stress again, firstly, that none of these decisions are being taken lightly. This is all about trying to save lives and minimise the health damage that this virus we know is capable of doing. But I also want to stress that we do believe these restrictions will make a difference, and indeed we believe they may already be making a difference. Even allowing for today's figures, though, it is, and I must insert this note of caution, it's too early to be absolutely certain about any of this, but even allowing for today's figures, we think that we may be starting to see a reduction in the rate at which new cases are increasing. So the early data underlines the importance of all of us sticking with the restrictions that are in place. Now, given that today's Cabinet decision requires many businesses to stay closed or continue to restrict their trading, I also want to confirm today that we will extend the support, the financial support available to them to cover the additional week. Full details of that support and how it applies to different sizes of business will be published online. But there will be extensions to both the business support grants that we offer and also the support that we are providing at this stage for the job furlough scheme. All businesses will receive proportionally the same level of support over the extension 7 days for each day of closure as they did in the first 16 days of restrictions. And for this limited period, as I say, we're also extending the Scottish Government furlough support scheme for an extra week as well. Now, later in the week, when we publish the new strategic framework, we will also set out our planned levels of support for business in the future in the event of further restrictions. It is important to be clear at this stage, and this is a point that I will speak more about in days to come, but I want to be clear about it now, that while the level of support we set out in the strategic framework will be the maximum level of support that the Scottish Government is able to provide within the resources available to us at this time, it is the minimum that we think is necessary. So in common with other devolved administrations and indeed many councils now across England, we will continue to pursue urgent discussions with the Treasury about the provision of adequate support and funding to support businesses and individuals through the kinds of restrictions that are likely to be necessary in the period ahead. Now, I spent, for good reason, a bit of time talking about the extension to the temporary restrictions, but I want to draw my remarks to a close by just giving my usual reminder of the general rules and guidelines that we are asking everybody to follow right now. Again, let me remind people living in Lothian, Lanarkshire, Forth Valley, Ayrshire and Arran and Greater Glasgow and Clyde not to travel outside their own health board area unless they really need to do so. Let me remind everybody, all of us across the country, that we should not visit other people's homes right now, except for very specific purposes, if you are providing childcare or looking after a vulnerable person. And when we do meet people from other households, outdoors or in indoor public places that are open, for example cafes, we shouldn't be meeting in groups of more than 6, and those 6 people should not come from more than 2 households. Please don't share cars with other people outside your household if you can avoid it. Work from home if you can, and download the Protect Scotland app if you haven't already done so. And finally, remember to wear face coverings when you're out and about. Remember to avoid crowded places. Remember to clean your hands and hard surfaces. Remember to keep 2 metres distance from people in other households, and remember to self-isolate and get tested if you have any of the symptoms of COVID. Thank you all for the sacrifices you continue to make. It will make a difference. I know it is hard, but we must stick with it in order to continue that process of getting COVID under control. I'm going to hand over to Jason for a few words before we take questions as normal.
Thank you, First Minister. The world this week reached 40 million COVID infections, has now passed 5 million cases. The world has not seen a global pandemic on this scale since 1918. Spain has had 14,000 cases in the last 24 hours and 218 deaths. France has had 20,500 cases and 262 deaths. You heard a number of large numbers from the First Minister today. Nearly 1,800 positive cases, a 10% positivity rate, 73 people in intensive care tonight, families, friends, concern for them. 873 people in hospital, up nearly 50 in a day. And most concerning and most depressing of all, 28 deaths. Each of these numbers, from the global number, from the other European countries, to our own numbers today, are stark warnings of what this virus can do and what it continues to do to the people of Scotland. But there are also grounds for cautious optimism. What we discussed yesterday, the non-pharmaceutical interventions, the NPIs, the distancing, the hand washing, the face coverings, they work. Reducing contact with other people, it works. 2 weeks ago today, the senior clinical advisors to the government published an evidence paper. And in that evidence paper, we said the doubling time for infections was 9 days, up to the 30th of September. And that had got worse. It had come down from 11 days in the week previously. On the 7th of October, 2 weeks ago today, there were 1,054 positive cases. So if the doubling time were 9 days, that would mean by the 16th, 5 days ago, there would have been 2,100 cases. And there weren't. So that would suggest the restrictions that are in place that you are following, from the household restrictions a number of weeks ago to the hospitality restrictions now in place, and the others across the Central Belt, they are working. But they are working slowly. And that's why we are reluctant to move away from them. To balance that though, in the week before the evidence paper published, there were a total of 18 deaths reported, and today we've reported 28 in a single 24-hour period. So your behaviour today literally saves lives, but not today. It saves those lives 3 to 4 weeks from now. This is not like doing life support at the side of the road and saving a life in that half hour. It is unfortunately much further away. Your hand washing, your distancing, your reducing social interaction save yours and others' lives, but not for 3 to 4 weeks. That's why it's so hard and so important that you stick to these restrictions.